Bismillahirrahmanirrahim. This is Abdur Rahman and you are watching the Animals Production Practices. In today's lecture we are going to talk on the very common disease of the poultry birds, especially the layer birds, the fowl typhoid. The fowl typhoid is very common in the layer birds. It is a managemental disease, may be caused by the poor managemental practices, poor unhygienic conditions in the farm. We will discuss the etiology of the fowl typhoid, similarly the treatment, different symptoms after the exposure of the body organs of the poultry birds affected by the fowl typhoid. So let's start. This disease is associated with the unhygienic condition and poor management. As I said earlier, this is a purely managemental disease. If the managemental practices are good at the farm, this disease can be prevented. Most commonly found in egg producing units like the layers or the layer breeders, broiler breeders, etc. Synonyms. The following names are also being used in the industry or the field to describe this disease, like infectious, leukemia, and the klien's disease. The definition of the fowl typhoid is: it is characterized by profuse, bright, sulfur yellow diarrhea, profuse, bright, sulfur yellow diarrhea, sleepiness, laziness in the birds, sleepiness, and anemia of the comb and wattles may also occur in this disease. These are the major and most prominent symptoms if the poultry birds are affected from the fowl typhoid. The diarrhea, sleepiness, and anemia are the major problems which may occur in the poultry birds affected from fowl typhoid. The etiology of the fowl typhoid is Bacillus gallinarum. This is the microorganism which is causing the fowl typhoid in the birds. It is killed in a few minutes by direct sunlight. The transmission of this disease may occur by vertical as well as horizontal. By vertical from eggs from the parents, and from horizontal like the transmission from equipments or the like birds, from the other birds, or any other poor managemental practices may also lead to the spread of this disease. Ingestion of contaminated feed, water, and droppings. This is also a good and unfortunately most detrimental factor which is causing this disease. Attendance through contaminated hands, feed, and clothes. The workers, untrained workers working at the farm may also the cause of disease if they are in the poor unhygienic conditions. Feed and egg collection, transporting machines or the vehicles may also the vector of this disease. Careless disposing of dead birds, carcass. In carcass, it survives 7 months and in droppings 1 to 2 months. You can see this microorganism is surviving even after the death of the bird in the carcass for the 7 months, and in the dropping it is still alive for 1 to 2 months. You can imagine that even after the death of the bird, it is also still damaging, still can be threat for the other birds. Signs and symptoms: birds become weak, comb and wattles become black and congested, yellowish colored faces, sometimes green or grey, or sulfur yellow color. High body temperature may also occur. Eventually the fever. Liver become dark red when exposed to air. Its color change into bronze. We will see in the later slides one by one all the organs of the poultry birds like the liver, spleen, kidneys, the internal vesicles, all the things, all the organs will be shown which are affected from the fowl typhoid. Swollen and congested sleep, this will also see in the later slide. Lungs show yellowish brown color, congested and edematous. On opening the intestine, there may be yellow colored feces and mucus. If we talk about the prevention and control, then good managemental practices, maintaining good biosecurity practices, maintaining good conditioning of good conditions of feed and water may eventually lead to the successful production of the flock without any disease. First one, visibly affected birds should be destroyed and carcasses of dead birds should be disposed of. Proper hygienic conditions must be maintained at farm. Droppings of infected birds should be properly dumped. Addition of furazolidone in feed at the rate of 0.04% for 10 days. Carrier birds must be detected and culled from the flock. Do proper disinfection of hatchery and chick transporting vehicles. Vaccination of birds should be done as per the vaccination schedule. Treatment. In case of outbreaks, the previous slide was just about the prevention. How can we prevent and control? This is the treatment. In case of outbreak, if the disease has happened, then what can we do? First, reduce the body temperature of the bird by calpol syrup by inducing calpol syrup or soda salicylate. 1 teaspoon per gallon for 5 tablets of paracetamol per gallon. Furazolidone is the drug of choice. Furavax 1 tablespoon per gallon. Similarly, CF suspension half teaspoon per gallon. Chlorophenol capsules 5 to 6 capsules per gallon. Furazolidone 20 gram per bag. Furazole 1 tablespoon per gallon. Similarly, furazole 80 gram per bag for 7 days. This is the liver of the poultry bird. You can see, first of all, its size is enlarged. The next most prominent thing is its color. We will first describe the process. The outbreaks usually begin with the sharp decline in the forage consumption and egg production. As soon as this disease occurs, the acute fever or instantly the egg production will reduced and leading maybe resulting from the forage consumption reduction. The fertilization and hatchability rates are considerably reduced. Diarrhea occurs. The death rate in acute fowl typhoid is high and varies between 10% and 90%. About 1/3 of chickens hatched from eggs from high typhoid infected flocks die. If the production we are still taking from the affected birds, then even after the hatchability or successful hatchability, our chicks are not going to survive. About 1/3 affected chicks will die. A characteristic lesion for Acute fall typhoid in adult birds is the enlarged and bronze greenish tint of color. The color of the liver is bronze greenish and the size of the liver has also been increased. This is also the liver which is enlarged but is mottled with multiple miliary necrosis. The outbreaks are observed primarily in the hens and turkeys, but the disease is sometimes encountered in other domestic or wild fowl. In other cases, the size of liver necrosis varies from miliary to spots with a diameter of 1 to 2 cm. Unlike pullorum disease, fall typhoid is lasting for months. Fall typhoid is very dangerous disease which may survive, which may be present in the birds for even the months. This is a spleen. The spleen is 2 times bigger, sometimes with a grayish whitish nodules prominating on the surface representing hyperplastic follicles. You can see the whitish tints on the surface of the spleen. Often enteritis, especially of the anterior part of small intestine, sometimes with ulcerations, is present. The etiological agent is Salmonella gallinarum. The organism usually shares common antigen with Salmonella pullorum, and two microorganisms often give a cross-agglutination reaction. Ulceration may also occur in the intestine of the birds affected from fall typhoid, but we should not confuse with the Salmonella pullorum, as in both diseases this symptom is common. More rarely, myocardial necrosis due to Salmonella toxins are detected. You can see necrosis is also in the myocardial, in the hearts. The transmission of the infection by contaminated eggs is especially important. Moreover, the transmission of Salmonella gallinarum occurs mainly among growing or productive flocks, and the death rate among adult birds is high. They are hanging with the muscles, appear like hanging muscles with the muscles. Fall typhoid should be differentiated from other salmonellosis, E. coli infections, Pasteurella infections. If breeder flock are proved to be carrier of infection, their eggs should never be used for breeding. Similarly, you can also see the internals of the bird. The going out of yolk from degenerative follicles results in fibrinous adhesive peritonitis. Taking into consideration that chemotherapy does not eliminate the carriership, the treatment of poultry infected with fall typhoid or pullorum disease is not justified and is never recommended. That's all about today's lecture. If you have any question, you may ask in the comments. Please like this video or the lecture. This is your host Abdurrahman. By profession, I am an animal nutritionist. Being an animal nutritionist, we should be aware of all the diseases, of course the managemental diseases at the farm, of the birds, of the livestock or the other animals. As the Feed is the basic ingredient in the production of the birds. So please like, share, subscribe my channel. Thank you very much. Assalamu alaikum.